psoriatic arthritis just affect the skin?
No, it affects the joints. That's why there's arthritis associated with psoriasis. It affects the skin, and sometimes also the inflammation can be in other parts of the body, like in the eyes, so it can cause inflammation in the eyes. All of the arthritis can affect other parts of the body.
Okay. What sort of is the classic age range that people get diagnosed, if there is such a thing?
Yeah, really, psoriatic arthritis can affect at any age. It can affect people in their childhood, anytime. But the age group where it's most common is between ages of 20 and 50.
And what are the chances of developing psoriatic arthritis if you have psoriasis?
We usually say roughly a third of people who have psoriasis will get arthritis. But it's really important for people to realize that they don't necessarily go hand in hand, in the sense that you may have had a few patches of psoriasis years and years ago, and your psoriasis is completely inactive and you might develop the arthritis later. Or even some people get the arthritis before the psoriasis, which makes the diagnosis very tricky.
No kidding. What then are the hallmark sort of signs and symptoms of psoriatic arthritis? What are you, as a highly specialized physician, looking for?
Yeah, so what makes us say that it's psoriatic arthritis, obviously if people have psoriasis it raises our suspicion, but it doesn't necessarily make that diagnosis. Psoriatic arthritis is kind of the great mimicker. It can have multiple different patterns. So in some people it primarily affects the spine, so pain in the neck and in the back and in the lower part of the spine where there's the sacroiliac joints. In other people, it's more the small joints, like the small joints of the hands and feet. And then in other people, it just picks at a joint here and there, so a shoulder, a knee, an ankle. And then the other really hallmark of psoriatic arthritis is that it's not just the joints that it affects. It also affects particularly where tendons insert into bone. So things like where the Achilles tendon inserts into the heel, or plantar fasciitis, which gives you pain on the sole of the foot. And then the other thing is sometimes it'll cause swelling of a whole digit. So we call this a sausage digit. So a whole finger or a whole toe that becomes red and swollen and painful because there's inflammation in the soft tissues around the joint.
Okay. And what do blood tests confirm, or rather not confirm, in psoriatic arthritis? What are you looking for in those tests?
So there's no test that diagnoses psoriatic arthritis. So when we do blood tests, it's partly to, I don't like the word exclude, but to make other diseases less likely. So we do check a rheumatoid factor and an NTCCP that would point more towards rheumatoid arthritis. And we also do blood tests to monitor the level of inflammation. So things like a CRP or an ESR. But what happens with psoriatic arthritis is that many patients, their inflammation in their body is not reflected in their blood test, which is often frustrating to patients. They go, well, this doesn't reflect how I feel. And what really matters is not their blood test. What really matters is how they feel.
So what's important to explain to your patients, Dr. Lacaille, about the risks or the consequences of either untreated psoriatic arthritis or undertreated? So where they're undergoing treatment, but it's not enough. What are the risks?
Yeah. We know that when inflammation goes on unchecked, it damages the joints. And in psoriatic arthritis, what it often looks like is what we call fusion of a joint. So the body reacts to the inflammation by laying extra bone, and then the joint becomes fused and it doesn't move. So in a finger, it will mean that you won't be able to bend the finger. So the big risk is damaging the joints and losing mobility, which means losing function. And then there's also the risk of what we call systemic inflammation. So there's inflammation in the joints, but there's also inflammation in the body that then puts patients at risk of other chronic conditions like heart disease.
So what other specialists might a person with psoriatic arthritis see besides a rheumatologist such as yourself?
Well, the most common one that people will see will be a dermatologist. Right. So, we're there to treat the joints. We're not there to treat the skin. It's not my expertise. And then the other specialist often is if the eyes are involved, then it's critical to be seeing an ophthalmologist, because they need to have the eye examined properly to make sure that we get rid of all the inflammation inside the eye, because that can also cause damage to the eye, and vision is obviously very important.
Right. And what about, I know from the literature that rates of depression actually in psoriatic arthritis are quite high, higher than in other types of autoimmune disease. What's the role of counseling or a psychologist? Is it prominent in this area, this disease area?
Yeah, it's very important. I think it's really underutilized, under-recognized. I think patients often do not necessarily recognize that they may be experiencing depression. So it is a really important part of the holistic approach to patient care to make sure that people's emotional well-being and mental health is addressed. And there are people there to help for that.